Okay, so we're going to see the individual bones and their markings. So we will start in the skull bones, and the skull has facial bones in here. It has the calvaria, which is this, and it has the cranium, which is this. So with the frontal, so we have this region in between the eyebrows that is called the glabella, and then this will be the supraorbital margins, and above the supraorbital margins we have this foramina, which are the supraorbital foramina. Supra means above, and this is the orbit. So this is the supraorbital foramina. Now, for the parietal bone, which is this one, we don't have major markings. For the occipital, which is this bone, we have this, which is the external occipital protuberance, and then we have this supranuchal line and then the infranuchal line in here. Internally, you will be able to see in the occipital bone, and also you can see it externally, this big hole that it is called the foramen magnum. On the sides of the foramen magnum, we have the occipital condyles. These occipital condyles articulate with the atlas, C1. And then internally here, within the occipital bone, you will be able to see these little holes, which are called the hypoglossal canal. So cranial nerve number 12, hypoglossal nerve, passes through here. This nerve is the one that allows us to move our tongue. So then for the sphenoid, which is the bone that forms the center of the cranium, we have the body, which is this, and then within the body we have this concavity that it is called the sella turcica. The sella turcica has a major depression as well that it is called the hypophyseal fossa. So our pituitary gland or hypophyseal fossa, it's located within this region. Now on the sides of this sella turcica, we have different foramina or holes. So we have this major one posteriorly, which is called the foramen ovale. So cranial nerve number 5 or trigeminal passes through this. And then we have this that is called the foramen rotundum. And anteriorly, we have a little hole that is called the foramen spinosum. Now this part in here, it is called the greater wings of the sphenoid, and this part in here is called the lesser wings. The sphenoid sometimes is compared like if it was a bat with spread wings, and that's why it has like lesser wings and greater wings. Now the greater wings, you can also see it here laterally, and here at the posterior region of the lesser wings, this is anterior, this is posterior, we have these pointed processes. These are called the clinoid processes. And then medial to the clinoid or clinoid processes, we have this hole that goes into the orbit that you can see there, that's the optic canal. So cranial nerve number 2, or optic nerve, passes through there. So that's the one that allows us to see. Now, anteriorly to the sphenoid, we have the ethmoid. And in the ethmoid, we have this pointed projection that goes up, that it is called the crista galli. And on the sides of the crista galli, we have this perpendicular plate, which has holes. And these holes are called the olfactory foramina. Foramen is one hole, foramina is many holes, so it's plural. So through this olfactory foramina, we have the olfactory nerves that makes cranial nerve number 1, or olfactory nerve, passing through here. So olfactory nerve is the nerve that allows us to smell. Now for the temporal bone. So for the temporal bone, we have different regions. We have the region that you can see laterally in here. This is the squama. And then it has this projection that is called the zygomatic process. The zygomatic process of the temporal bone connects to the temporal process of the zygomaticus, or the zygomatic bone, which is the cheekbone. So they form this bridge. And so this is the squama again. This is the zygomatic process. And this process, or this part in here that is inferior in the temporal bone, this is called the mastoid process. The mastoid process, you can feel it here just behind your ear. And this is a place where complications of middle ear infections can go into. So the children usually, hardly an adult, but when a children has a middle ear infection, the microorganisms can go into this process, the mastoid process, and it can cause mastoiditis. Now, anterior to the mastoid process, we have this hole in here that is called the auditory canal, or external acoustic meatus. So this is where waves of sound passes through to go and stimulate the tympanic membrane, so we can start increasing these vibrations of the sound waves, so we can hear. So this is the external acoustic meatus. Now, this inferior region of the temporal bone is called the petrous part. And in the petrous part, some things that you can see is this pointed projection that you can see laterally as well. This is called the styloid process. So several muscles inserts into the styloid process. Now, medially to the styloid process, we have this ragged part that you can see also through here. So this, it is called the jugular foramen. And the jugular foramen, you can see it as well in here. Now, within the side of the jugular foramen, or sorry, medial to the jugular foramen, you can see the carotid canal, which is this. Now, internally, the cranium is subdivided into fossas. So we have here the anterior cranial fossa, which is made by the lesser wings of the sphenoid, the ethmoid, and the internal part of the frontal bone. And then here, this region will be the middle cranial fossa, which is made mainly by the temporal bone, the petrous part, and also the greater wings of the sphenoid. And then posteriorly, just made up by the occipital bone, which is this, we have the posterior cranial fossa. Now for the lacrimal bone. So the lacrimal bone, it's a tiny bone that is located within the orbit, and it has this little hole that is called the lacrimal canal. So when we produce our tears by the lacrimal gland, that we have it here within the orbit, superior and laterally, the tears will flow down and medially, and then they drain through this lacrimal canal into our nose. Now, this jagged edge that you can see here in the orbit is part of the sphenoid. This is the supraorbital canal or fissure. And then just below into here, we have the infraorbital fissure, which is made by different bones like the zygomatic, like the frontal, the sphenoid. And the ethmoid, you can see it very, very deep into the orbit. It's hard to see, but the ethmoid is here, and also the ethmoid forms this part of the nasal septum. So the bony nasal septum. So the bony nasal septum separates the nasal cavity, which is this, into right and left. And it's made by the ethmoid, and also it is made by the vomer, which is this. And then in here we have the paired nasal bones. And then in here we have the zygomatic bones. And then here we have the maxilla. The maxilla has this pointed projection that is called anterior nasal spine. And then we have this infraorbital canal through which the infraorbital nerves and blood vessels passes through. Now in the maxilla and also in the mandible, we have this kind of oval structures. These are called the alveolar processes. That's where our teeth fits into. And then here on the inferior view of the maxilla, you can see the incisive fossa, which is this, and these will be the palatine processes of the maxilla, and this will be the palatine bone. The palatine bone has, at least shown in here, the greater palatine processes, and these will be the maxillary processes of the palatine bone. So the maxilla has the palatine processes, and the palatine bone has the maxillary processes, and both they connect. And for the actual mandible, so the mandible articulates with this part of the cranium, which is part actually of the temporal bone, that it is the temporal fossa. So the temporal fossa articulates with this part of the mandible, which is the mandibular condyle. And this is the only movable articulation that we have in our skull. So this will be a synovial or diarthrosis. And the rest of the articulations in our skull are sutures or immovable joints or amphiarthrosis. In infants, these bones are not completely fused, or they are tightly connected. So the children, they have very few sutures. They have fontanelles, pads of connective tissue that still hasn't ossified. And the reason for the infants and the babies to have this type of structures is because when they're passing through the birth canal, their cranium gets squished a little bit, and when they are growing, their brain is growing. So they need to have these articulations that are flexible. But once you start growing and then your brain stops growing, you don't have to have any movements between the bones of the skull. So these are then the connections or the sutures in the skull. So this connection between the frontal and the two parietals is called the coronal suture or frontal. And then this connection between the right and the left parietals, This is called the mid-sagittal suture. And then this connection that is like an inverted V shape between the occipital and the parietal bones, this is called the lambdoid. And then the suture between the temporal bone, the squamous region, and the parietal, this is the squamous suture. And this connection in the hard palate, which is this is called the mid-palatine suture. Now for the parts of the mandible. So we have the mandibular symphysis, the region where the left and the right mandible originally fused. So this is the mandibular symphysis. We have the alveolar processes, similar as to the alveolar processes on the maxilla. And then this will be the mandibular foramen. This will be the cornoid process, and this will be the mandibular notch. This will be mandibular ramus, mandibular angle, and mandibular body. And that's all for the school.